Good morning, everybody. This is Dr. Chris Ebert-Santos from Ebert Family Clinic in Frisco, Colorado, with our weekly update on COVID, particularly focusing on the mountains. Today, we're going to talk about the multi-organ inflammatory syndrome in children and some of the ways we can reduce our risk of contracting the coronavirus. The new syndrome in children was first reported in England a month ago and hit New York 2 weeks ago, and may be starting to in Colorado in the upcoming weeks. These children have fever, shock, rashes, vomiting, diarrhea, carditis, and arthritis. Almost any part of the body can be affected, and they have either a history of a positive COVID test or exposure to COVID in the family. It's very rare. There have been only one or two deaths, but we do want to continue to use all precautions to prevent the spread of the coronavirus and the risk of our children being affected by this disease. We did have a conversation with one of our local moms in Breckenridge who's on the board of Timberline Daycare, and she's going to talk to us about the measures they are taking to keep children safe.
My name is Michelle Kilduff, and I live in Breckenridge, Colorado. I have a almost 3-year-old and a 4-month-old who attend Timberline Learning Center up here in Breckenridge. I am a board member, and we have been meeting once a week for the past month or so to try to figure out how to reopen the daycare with all of this COVID-19 scenario. We have extensively talked amongst ourselves and the teachers and other directors, and we've trying to come up with some guidelines for us to make sure that everyone's safe, the teachers, the parents, children, everyone all together. So we are hoping to open June 1st, and we are going to set some guidelines where the parents cannot drop the children off inside. They drop them off at the playground. Everyone will be 6 feet social distancing. We'll take temperatures of parents and children before they come in. If anyone in the household has any signs of or symptoms of anything related to COVID, we are asking them not to bring their children to school, as well as possibly getting tested for COVID before they would return. Obviously, the biggest thing is safety. We are starting off with half days. And then if that goes well, we'll move into 2/3 days and then full days. Trying to get the kids back to being away from their parents for the last 3 months is also going to be very interesting. And we're trying to kind of work with that to, again, give them that healthy learning environment. So, because they're going to want to run up and hug their friends immediately. And that's going to be something that we're going to have to work with the teachers on how that all looks.
And they'll be wearing masks.
Yep. Children over 3 will wear masks. All the staff and admin will have masks. They did, the state and the county did say that children under 3, it does hurt their breathing. So, or they could have respiratory issues with it. So that if they're 3 and under, they don't have to wear one.
Yes, and the Children's Hospital says 2 and under, no masks.
Okay, perfect. Yes. And then we are keeping no more than 10 kids in a room at a time. So if we need to, we're sent a survey out to parents. If it's not an as-need basis, if both parents aren't working and there's still a parent at home, we're asking them to keep their child at home. This isn't just to kind of, have a little alone time as families. This is for people who really need it, essential workers or people who are starting to go back to work. We're trying to keep it as low attendance as needed.
And you'll be able to survive financially that way.
That's what we're working on right now. That's the hard part. Daycare up here is hard to find. And so as board members, we're trying to figure out if families have to hold their spots by paying a decreased rate if they're not bringing their child to try to help us financially keep open. We have been lucky. We've gotten several grants to be able to keep us afloat, as well as we've been able to get a grant to pay our teachers so that we know that they're coming back. We're not having to hire new people that we don't know. And so that transition for the kids and parents should help a little bit with just teachers that they know and they've seen for the last couple of years.
That's very reassuring.
You know, we're just as nervous. We're not super gung-ho to open up June 1st. We're not trying to push this at all. But we do know that in order to start getting things going again, we do need to have available daycare for parents so that parents can go back to work. So we're definitely not taking this lightly at all. We are open for any suggestions. If anyone knows a daycare center that has great procedures in place that have been working, we are all ears, because this is obviously new and none of us have ever done this before. So we're trying to just go day by day and see what's best for everybody, because again, the safety of everyone is the most important thing. And once we do open, we want to be able to stay open. So we're going to try to take this slowly and as precautionary as possible.
Well, thank you very much. That's all very helpful and reassuring. And we're so proud to have people like you in our community, and look forward to just gradually being able to get back to work.
Thank you, Dr. Chris. We appreciate everything that you do as well.
I'd also like to share with you several publications this week in the New York Times and the New Yorker that talk about how to reduce our risk of COVID. Erin Bromage published an article called Risks and How to Avoid Them, and discusses people who have contracted the coronavirus at birthdays, funerals, restaurants, workplaces. What were the situations and what was the outcome? You can link to this article from our Facebook site, Ebert Family Clinic Facebook. It is an excellent and detailed description of how people get sick and how they don't get sick. The good news being it's extremely rare for anyone to contact the coronavirus from an outdoor activity. So if we are safe to go out there and recreate. But as pointed out in the New Yorker article by Atul Gawande called Re-Entry, it is very important to maintain the 4 basic ways of reducing infection. He writes about how hospitals have been successful to keep their staff safe by implementing what we have all been hearing about. First of all, screening for symptoms. Anyone who feels sick, even if it's just a runny nose, a sore throat, stay home. Temperature screening is not so sensitive because many times the fever doesn't come until several days into the illness. And we all know that the illness can be spread even before you have symptoms. So the other 3 methods of preventing infection are equally important. Social distancing, 6 feet, wearing masks, and frequent hand washing. Also wiping off surfaces, but hand washing is more important. All these 4 things together are keeping most healthcare workers safe, and they can keep us safe. I encourage you also to read this article. We will have a link to this on our Facebook site. So we can do this. We can go back to work little by little. We can spend a little more time together with social distancing, and we can expand our world. Just stay safe and practice these 4 safety measures of hand washing, distancing, stay home if you're sick, and wearing masks. Thank you.